So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease-free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome everybody to another live discussion with Assuaged Foundation. Today we're going to be talking about borderline personality disorder, or BPD. We want to thank all of our student speakers today: Crystal Rylowicz, Raven Moore, Jayashree Salian, Maria Reyes, and Kaylnn. We also want to thank the slide contributors for this week that built out the presentation: Crystal Rylowicz, Maria Reyes, Bishara Sheikh, Raven Moore, and Soleil Zamora. A special thank you goes out to Restream for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it most. For today's agenda, we're going to begin talking about what is borderline personality disorder, talking about prevalence, symptoms, and causes. We'll look at diagnosis and assessments, and then treatment options. Stigma and misconceptions. We'll talk about one person's personal story, as well as BPD in pop culture, and then look at some supportive resources and helplines, as well as the suicide risk data. And now I will turn it over to Maria.
Oh, sorry. What is borderline personality disorder? Borderline personality disorder is a mental health condition in which a person has long-term patterns of unstable or explosive emotions. These inner experiences often result in impulsive actions, self-image issues, and chaotic relationships with other people. Prevalence. According to the National Alliance on Mental Illness, almost 3/4 of people who have been labeled with BPD are women. New research shows that men may be just as affected by BPD as women, but they are often mistakenly diagnosed with PTSD or depression. The prevalence of borderline personality disorder, BPD, includes 1.4% of adults in the US who have this diagnosis. Symptoms. Some essential signs and symptoms according to the Diagnostic and Statistical Manual Diagnostic Framework may include: people with BPD can experience extreme mood swings and general sense of insecurity, self-harming behavior, including suicidal attempts or threats, dissociative feelings, disconnection from your ideas or self of identity, out-of-body feelings and stress-related paranoid thoughts, and feelings of boredom or emptiness on a regular basis.
Part 1. Causes of BPD. The causes of BPD are unknown, although scientists agree that it is caused by a mix of variables, including genetics. While no specific gene or gene profile has been established to cause BPD, research suggests that persons who have a close family member with the condition may be at a higher risk of developing it. Part 2. The causes of BPD are unknown, although scientists agree that it is caused by a mix of variables, including environmental factors. People who have had severe life events such as a physical or sexual abuse as a child or neglect and separation from their parents are more likely to develop BPD. Brain function is also a cause. The emotional control system in individuals with BPD may be altered, implying that some of the symptoms have a neurological foundation. The parts of the brain that control emotions and decision making and judgment, in particular, may not communicate efficiently with one another. Diagnosis. BPD can be a difficult diagnosis because of similarities to other conditions, particularly mood disorders. A licensed mental health professional, such as a psychiatrist, psychologist, or clinical social worker, can diagnose borderline personality disorder based on thorough evaluation of symptoms, experiences, and family medical history. A careful and thorough medical exam can help rule out other possible causes of symptoms. BPD is usually diagnosed in late adolescence or early adulthood. Occasionally, people younger than 18 may be diagnosed with BPD if their symptoms are significant and last at least 1 year.
Assessments. There's no biologically based test to definitely diagnose BPD. Mental health professionals often use thorough screening assessment instruments to help identify the likelihood of BPD and the need for further evaluation and treatment. Types of assessments used for screening and diagnosis of BPD are McLean Screening Instrument for BPD, also called MSI BPD, Personality Diagnostic Questionnaire 4th edition, BPD Scale, also called PDQ-4, Structured Clinical Interview for DSM-5 Access to Personality Disorders, Patient Questionnaire, BPD Scale, also called SCID-2 PQ-BPD. Furthermore, on assessments, internationally recognized criteria are used to diagnose BPD. Diagnosing BPD requires that the patient fulfill 5 out of 9 DSM-5 criteria. The mnemonic impulsive is a helpful way to remember BPD criteria. Impulsiveness in two potentially damaging areas, which could be sex, substance abuse, shopping, mood instability due to marked reactivity, paranoia or disassociation under stress, unstable self image, liable intense relationships, suicidal gestures, inappropriate anger, vulnerability to abandonment, frantic efforts to avoid real or imagined abandonment, emptiness or chronic feelings of emptiness. Treatment options would be psychotherapy, dialectical behavioral therapy, which is also called DBT, cognitive behavioral therapy, also called CBT, and psychodynamic psychotherapy can all help with coping with emotional dysregulation. Medication may be useful in a therapy strategy, but no single medicine is specially designed to treat the basic symptoms of BPD. Rather, a variety of drugs can be used off-label to address a variety of symptoms. Groups, family, and peer support. This support can foster an atmosphere of empathy, trust, and open communication. Hospitalization to assure safety, high stress, or impulsive or suicidal conduct, short term hospitalization may be required.
Dialectical behavioral therapy. Dialectical behavior therapy, DBT, is a set of skills designed to be used in a group setting for personality disorders. Still, it can be used in daily lifestyles even when a mental health diagnosis does not exist. Acceptance skills. Mindfulness allows you to be in the moment, here and now, to concentrate and be aware of your current surroundings and thoughts. The stress skills allow a person that is in conflict to deal with the situation in an appropriate emotional way without making the situation worse. Change orientated skills. Number one, interpersonal effectiveness skills allow people to effectively deal with others while asking and getting what you need in a healthier and more positive manner. Number two, emotion regulation allows the person to feel their emotions, define them, and use them appropriately without being aggressive so that those emotions can be heard and not judged. Medications. BPD has many medication options that include antidepressants, antipsychotics, anticonvulsants, which are mood stabilizers, and anti-anxiety drugs. Antidepressants are Nardil, Prozac, and Effexor. Antipsychotics include Geodon, Seroquel, and Zyprexa. Anticonvulsants are Depakote, Lamictal, Tegretol, or Carbitrol. Anti-anxiety includes Ativan, Klonopin, Xanax, and Valium. Stigma and misconceptions. Stigma surrounding BPD. There is a strong stigma It froze temporarily. There's a strong stigma that BPD patients lack responsibility and are unstable, as well as BPD cannot be treated. This stigma often leads to the patient not seeking treatment, harassment, and bullying due to embarrassment of their illness. Common misconceptions. BPD only affects adults, specifically women only. Patients cannot lead independent lives. BPD cannot occur in individuals younger than 18. BPD is not a valid diagnosis. Crystal's personal story. I was diagnosed as an 11-year-old child with various mental health disorders. I was not told of my BPD diagnosis until I turned 18. BPD has destroyed my personal relationships to the point where I cannot stand to live alone, but I do nothing but argue with my partner. I am now 44 years old and have learned to cope with my emotional roller coaster that BPD has taken me on through, to include one-on-one therapy, seeing a psychiatrist, and completing 1 year of dialectic behavioral therapy in a group setting. While every day is a battle, I have to conquer my BPD one day at a time, sometimes second by second, or even minute by minute.
BPD in pop culture. Girl Interrupted, book and movie. In 1999, Winona Ryder played a young woman named Susanna who was diagnosed with BPD and displayed symptoms of fear and of abandonment, impulsivity, and unstable relationships. Harley Quinn, Marvel Comics, and first appeared in 1992. Harley displays a fear of abandonment, impulsiveness, and a history of aggression and abuse. Maleficent, Disney character in a movie, 2014. She is a Disney character from Sleeping Beauty that displays extreme emotional reactions, is highly impulsive, and has a history of unstable relationships. Effie, 2007. She is a television character that has mental health symptoms that individuals with BPD can identify with. She does not trust or love others and engages in self-destructive behaviors. Supporting loved ones. Supporting your loved ones is important. Those with BPD tend to struggle making and managing meaningful relationships, although they are essential for their recovery. Greenstein, 2217. Ways to show support include encouraging and understanding their treatment, showing appreciation and giving verbal affirmations, be responsive and willing to communicate, giving grace and not placing blame. Suicide risk. BPD is associated with suicidal behaviors and self-harm. Suicide rates are high in BPD, where interpersonal problems trigger intense emotional dysregulation and impulses to act on suicidal thoughts. Research has shown approximately 70% of people with BPD will attempt suicide at least once in their lifetimes. About 10% complete the act of suicide. This suicide rate is higher than any psychiatric disorder and the general population. Suicides in BPD occur later in the course of illness and follow long courses of unsuccessful treatment. Unfortunately, hospitalizing someone with BPD after a suicide attempt is generally not effective and is no assurance that another attempt will not be made. Once hospitalization is introduced, suicide attempts and admissions can become repetitive. Hospitalizations introduce an environment that reinforces, I can't say that word, or therapy attempts to extinguish. Resources and helplines. Emergency resources and support, National Suicide Prevention Lifeline, 988 Suicide and Crisis Lifeline. Disaster Distress Hotline, 1-800-985-5990. Crisis Text Line, text hello to 741-741, 24 hours a day. Accurate and honest websites with information on BPD include the following.
Okay, so thank you everybody for all of that information. We're going to move on to the question section now. So if everybody can turn on your cameras. We will start now with the first question. So what information or advice can you give to loved ones or family members of people with BPD? Support groups can inform families, friends, peers on how to support a loved one that has BPD and keep learning about causes of BPD and how recovery works. For individuals with BPD, access to treatment and high-quality care can help learn about how to handle stigmas and understand any challenges. So, Crystal, did you want to start us off with some information here?
Definitely. The one thing that I would really advise is, for some reason, borderline personality disorder is often a hush-hush thing, and they always want to jump to labeling you bipolar, and a lot of the symptoms mimic each other. So advocate for yourself. If you know that something is wrong and it feels wrong, it may take 2 or 3 different psychiatrists, 2 or 3 different therapists, 2 or 3 different group sessions, but also include your family and your friends, because their roller coaster is your roller coaster if you deal with them on a daily basis.
Yeah. Have any of you, other people on the call, have you dealt with this before, or had people in your lives that have dealt with this?
I have a few friends.
Oh, I'm sorry, we're both speaking at once.
Can I go ahead?
Yeah, go ahead.
Yeah, so in my last workplace, I had a coworker who used to, get episodes of this, but then I am still not sure whether it was BPD or whether she was dealing with some kind of depression symptoms, because the symptoms that are listed here on the presentation are so confusing, and I can imagine the diagnosis would be so hard. And I remember we as co-workers used to show so much support to her because she used to suddenly feel so sad and she used to sob all the time. Despite being so good at her work, she used to go through this very often. And I think one thing, like, mentioned in the question, I feel family members and friends and your coworkers need to be more supportive. Because if you try to distinguish between them and you, it would only make their symptoms worse.
Mm-hmm. Absolutely. And then Kaylnn, were you trying to say something earlier?
Say I have a few friends that have BPD, and I do notice that if they do have maybe like a few glasses of wine or something like that, their behavior does get a little bit realize like, okay, let me stop, drinking. It's affecting like my medication and also affecting my mood in this point in time. They might, get a little angrier than normal, a little bit faster, I've noticed.
Yeah, I can imagine that would, be a problem for certain people with with it interacting with the medications, or just, I mean, alcohol affects our behavior in general, right? So that's a whole nother interesting topic to even talk about, is, advice for people that have this on, how to manage those sorts of things that are behavior altering substances. Yeah. Anybody else?
I was gonna add on as well. So I work with a lot of families, and sometimes you come across individuals with different mental health diagnoses, and some of them might have borderline personality disorder. And I agree with what everyone else was saying, that support, having access to care, and mainly people understanding rather than, I would say, judging, because they might not know what it's like or not understand it, is very helpful for those individuals.
Yeah, and for those of you that have dealt with it, I'm curious too. So in the workplace, it seems to me that the other employees working directly with someone that has BPD, that it would benefit all of them for them to understand what the person's dealing with. But I have a feeling that they probably are not even informed because of different privacy laws, unless the person themselves chooses to share it, which could be difficult. Is that true?
Yes, I mean, in my case, I had that. I saw that happening, and it was so confusing for all of us because
Yeah,
we didn't know what is happening. We initially we thought maybe she's going through a breakup, and also like her immediate team members, they were frustrated because they started complaining that this is happening very often, and probably this is an excuse.
right.
But no, that was not the thing. She was very good at her work,
Yeah,
but then this was affecting her. So
sure.
yeah.
Yeah, well, hopefully since then she's gotten the help that she needs to be able to manage the
Yep, cope
symptoms
up,
better.
yes. Yeah.
Yeah, because it just seems like the bigger support group you have, especially at work, because if it seems like you probably can't control when you have symptoms that come up. Is that correct, Crystal?
It
Yeah.
is. They compare it to an overboiling pot of a popcorn, if you will, only because the medication, there is no one set medication directly for BPD. You can use a host, but just like any medication, nothing fully takes everything away. So even if you have multiple mental health diagnoses like I have, the medication may help with the anxiety and the PTSD and the depression. But when your borderline problems start cropping up, which is, your emotions, you really have to have skills and be good to notice when you're boiling over, because when you do, the medication just stops working and you are on that roller coaster, which is very similar to people with bipolar, which is also why it is so hard to actually diagnose bipolar versus BPD, and they are often combined into one, which makes it more difficult for you to receive support because there's so many misdiagnoses out there.
Wow. That makes a ton of sense. Thank you for sharing that. Let's see what the next question here is. How quickly can treatment start to significantly reduce symptoms of BPD? Is this person or case specific? While BPD is a very challenging disorder to live with and treat, there is an increasing evidence that a major consistent predictor of change is having severe BPD at the start of treatment. Getting involved in a variety of coherent, consistent, and structured ways of addressing the problems of BPD have immediate effects. Across studies, some of the major effects in symptom reduction, especially in the realms of impulsivity, happen right away. Significant symptom reduction can appear after 5 weeks of treatment. Situational changes can breed remission in as quickly as 6 months. What has your experience been with this, Crystal?
It has been horrible. I lived in New York State, and when I was 11, they back then could not diagnose minors with having BPD, but immediately they knew what it was. And BPD is genetic. So if you don't have it in your family, it just can't crop up like other disorders. And so they never could treat me. And then, they were treating me with all these medications that were never working and not giving me the DBT therapy. And so when I turned 18, they cited in my records in New York, it was BPD, but everybody kept it hush hush and kept telling me bipolar and still had me on the wrong medicine. Well, okay, you're not telling me and I'm not understanding what is wrong with me. I'm seeing professionals. I'm expecting that they're giving me help, and so sadly, it was in 2012, when I met my current partner, I ended up needing to get mental health therapy here in Tennessee, and I underwent all the evaluations. We got my records from New York, and they said, yeah, it's definitely borderline personality. Well, they did put me on medicine, and we started picking each diagnosis apart one by one until finally they said, okay, we are to the point where you need DBT therapy, but I had transportation issues. And so all of a sudden, I hate to feel this way, but COVID kind of was a blessing when it happened because everything went teletherapy. And that's how I was able to get the 1 year worth of DBT group skills. And I have to practice them every day. They do not always work. However, the purpose of that is retraining your brain to think differently and advocate. You can still be angry, but you don't have to cuss and swear and throw punches. And so now that I've gotten the DBT skills, some days they absolutely don't work, but I can catch my pot from completely boiling over. And now I have a much better management of, I can tell when my medicine is starting to take a slope and I'm going, okay, it's not going to work the rest of today. I'm going to have a problem tomorrow, but let's see what can I do to get myself back on track. So for 33 years that I've gone through this, it has been a very tough road. And all I can say is I'm still alive. Unfortunately, it took me to move to a different state to get help. But I'm very proud of myself for the help that I have gained. And I'm just going to keep going the best I can.
Absolutely. And good for you for just sticking to it and continuing to look for ways to find help for yourself versus just saying, well, I didn't get the help I needed. So, that takes a lot.
At one
lot of strength.
Yeah, at one point when I did get to Tennessee, I became so annoyed. I'm like, I've already been doing this. I don't want to keep doing this. Right. And I finally found the right person who said, we're going to pick your 5 disorders apart one by one because you're going to find that all 5 of the disorders you have all work together. So we can't fix your borderline personality, even if there was a magic medicine. We have to start with some of the other things that are rooting the borderline personality to just explode and take you on a roller coaster that just never will stop. And so, you have to be persistent. And a lot of people do not know how to advocate for themselves. And it took me a long time, but I have to practice it every day.
Well, good for you.
So you can do it with willingness.
Good for you. Good for you. That is awesome. And are there, and maybe this is another question we're going to get to, but are there support groups where other people that have managed, like yourself, that have been an advocate for yourself and you've managed to find the right care, even though it's taken you all these years to do so, that you are then supporting other people in support groups or some way?
I know that there's a lot of groups. I don't personally belong to any on Facebook. I just don't think that's the appropriate place for therapy.
Sure.
But like the place that I did my therapy through, they are connected on Discord. I chose not to get on Discord, but I'm still in touch with 4 or 5 members that I actually went through the group with and graduated with. And some of those members were fairly new when I was leaving, but we exchanged numbers and we keep in contact with each other. We check in at least twice a week.
Yeah.
So I would say that there probably are support groups if you really feel that that's something you need. And as stated, DBT is not just for borderline personality. It can be used for anything, everyday living, even if you don't think that you have mental health issues. Mindfulness is a beautiful thing just to balance out your equilibrium. If you're stuck in a moment and you need to put yourself in a 5-minute timeout, take yourself to a happy place and come back, and you will find that it has made a significant difference. So I'm sure that if you search for groups in the state that you live in, counseling agencies, your local health department may be able to put you in touch with someone who knows where you can get DBT. I do know that several of my group mates started their own little group outside of group therapy where they do meet on a social media platform. And again, I choose not to splash everything on social media. This is a big step for me today doing this, but I want to educate others on the journey that I went through, because a lot of people have never even heard of borderline personality disorder.
Right. Well, awesome. Thank you. All right, let's see what we have for the next one. Does borderline personality disorder mimic other mental health disorders that could possibly make it hard to diagnose? And I think we've kind of covered that, but I'll come back to everybody to see what input you guys have. The answer is yes. Borderline personality disorder can mimic bipolar disorder, depression, anxiety, and schizophrenia, just to name a few. It is best to be seen by a psychiatrist to be diagnosed, which can take more than one session. Since many criteria can overlap, BPD is often misdiagnosed and often diagnosed as bipolar. Being misdiagnosed does not help the patient or the provider, since BPD is non-manageable with medications and the treatment is dialectic behavioral therapy skills, as to where bipolar can be managed with medications and therapy. Anybody have some thoughts to add to this one? It seems to me, and I'm just wondering why our medical system wouldn't immediately, with anybody that comes in with any sort of disorder, personality disorder, emotional issues, why wouldn't we immediately put them in this DBT for help? Because it certainly wouldn't hurt them, I wouldn't think, if we don't yet know what medications to prescribe. It's like, it just seems like there's a disconnect with, again, we're so, I guess, prescription based in this country, which is, in my personal opinion, a problem in many ways. If there are other types of therapies that could begin helping anybody without any negative side effects, why not start there to get them some sort of help immediately while we figure the rest of it out? Does anybody have any thoughts there?
I can add on. So I live in California, and I don't work in the mental health field, but I do have to collaborate with them.
Yeah.
My job is pretty interdisciplinary, and so sometimes I have to refer families to get mental health support. And oftentimes there's different barriers to that, right? Like health insurance, staffing is a big one right now, I guess, because of, I think it's always been present, but it got worse during COVID. So even now, like, for example, how we were saying that you might need a psychologist or a psychiatrist to diagnose you, it's very limited. So that makes it more difficult. And usually they'll, like you said, direct you to a psychiatrist who can provide short-term or maybe not applicable or appropriate support, because the other options are limited.
Yeah. Interesting. And I'm guessing that's probably true across many, if not all states at this point. And certainly the insurance is an issue as well. I'm well aware of that. It tends to be, especially with private insurance, it seems like some of the state-run insurances that mental health is actually easier to receive than if you have private insurance through your job or that you're purchasing outside. They tend to be harder to get approval for the mental health that people need, it seems. Any other thoughts on this? Okay, let's go to next question. What medications are best to help treat those with borderline personality disorder? Main medications include antidepressants, antipsychotics, anticonvulsants, mood stabilizers, and anti-anxiety drugs. Although not curable, borderline personality disorder can be treatable. With borderline personality disorder therapies and medication, the condition can become manageable. Medication is most effective when used with other forms of borderline personality disorder treatment. Other treatment being one or more types of therapy. These medications are most often used as an additional treatment, not a primary one. Thoughts on this?
Unfortunately, living the life that very last statement that was made holds out to be true. Medication should not be the primary vehicle for dealing with borderline personality disorder. I tend to agree with you. Everybody should learn DBT skills because that's patient. And until you're seen through a period of 2 or 3 or 4 sessions, how can you just know what to diagnose a person with? And in terms of the medication, during the presentation, when I read off those different medications, I would say I was on probably 95% of them. And because they kept leaning towards it was bipolar, it was this, it was that, and we could never get to the root of the problem. No wonder why most of the medication did not work. So you really have to advocate for yourself. And the primary go would be this specific disorder. Others, it may be one not. You need to communicate effectively so that they know what problem you have so they can figure out the next piece of the puzzle to maybe include other therapy or medication.
Absolutely. Anybody else have thoughts here?
I just wanted to add on that I also agree with Crystal. I think it's sad that medications being like prescribed first instead of other therapies being explored. And maybe if like the therapies were explored first, they wouldn't need as much medication, and then overall they must be happier.
Yeah, absolutely. And, hopefully, like you had mentioned, Crystal, earlier, that now that there is more online virtual therapy happening, that people will be able to get better access to different group therapies. So that, that would definitely be something that would be helpful for sure. And, with all these medications too, not every medication works the same for every person, right? People have different side effects. People have different reactions. Some have a good effect, some don't. So I can imagine that the medication equation for this would just be very difficult to solve because you're trying all different types of medications, right, for all different symptoms, and then trying to get the right mix that works for that person. So it could be very, very challenging for sure. All right. Well, I think that covers everything for today. We want to thank all of you for being here and contributing. Crystal, thank you so much for all of the valuable input that you had here, specifically about your own story and everything you've been through. We greatly appreciate that because it's going to help to educate others. So thank you, everybody, so much, and we'll see you next time.